Hello and welcome to OffBlueMedical. Today I will show you an easy way to remember the autosomal dominant disease names for the USMLE. So for the USMLE there is a wide and a big list of autosomal dominant diseases, autosomal recessive diseases, X-linked recessive diseases and X-linked dominant diseases, and you will need to differentiate between all of these. So in this video I will show you how you can remember the autosomal dominant disease names for the USMLE. So the first two diseases are going to be the Ehlers-Danlos syndrome and Marfan syndrome, and what's common between them, how you can group them together, is that in both of these diseases you will be tall. Okay, the person will be tall, and they will have abnormalities with their joints and with their lens. The second group of diseases are going to be the achondroplasia, where you get a very short person because their long bones don't develop fully, and osteogenesis imperfecta, where you get babies that get their bones fractured easily because their bones are not perfect. Literally, it's called osteogenesis imperfecta. Their eyes are also going to be, sometimes you can see them blue because their veins are visible, and sometimes they have translucent teeth. The third group of diseases are these last ones, which I grouped together. So retinoblastoma, you can get osteosarcoma and retinoblastoma. Tuberous sclerosis, how you can remember this is by the word tube. So anything that is a tube is going to be dominant. Imagine a big tube, and a big tube is always going to be a dominant tube. For von Hippel-Lindau disease, you can remember this as, so we have two von diseases, von Hippel-Lindau and von Willebrand disease. Okay, and von is dominant. So von Hippel-Lindau disease and von Willebrand disease. The other group of diseases is going to be the blood clotting diseases. So antithrombin deficiency and factor V, Leiden thrombophilia, and protein C deficiency and protein S deficiency. These all cause problems with blood clots, and they cause you to get clots in your blood. Other group is going to be the autosomal dominant. This is from its name, autosomal dominant hyper IgE syndrome. It's also called job syndrome. How you can remember this is that when you get a job, you will be dominant. So job syndrome. And the other one is the autosomal dominant polycystic kidney disease, where you get multiple cysts in the kidney and the liver. You get berry aneurysms, you get diverticulosis, and you get hernias in the autosomal dominant polycystic kidney disease. The other one is going to be ALS, which is the disease where you will get upper motor neuron lesions and lower motor neuron lesions, but you'll get no sensory deficits. This is going to be ALS. The other group of diseases are going to be ones involving the blood vessels and the heart. So hypertrophic cardiomyopathy, so imagine a big heart, hypertrophic, a big heart is going to be dominant. So that's hypertrophic cardiomyopathy. And hereditary hemorrhagic telangiectasia is going to be autosomal dominant as well. You also have hereditary spherocytosis. Imagine blood cells that are going to be circular. So this is hereditary spherocytosis. The blood cells are spheres here. Imagine a big sphere that is dominant. The other ones are going to be these ones. So first one is going to be familial adenomatous polyposis, where this might cause colorectal cancer because you get polyps in the GIT system. Juvenile polyposis syndrome, you also get polyps in the GIT system. Leaf-Romani syndrome, there are going to be multiple tumors of the liver, lung, suprarenal glands, and in the brain, sometimes in the bone. You get men's syndromes, so you can remember this is by the, if you think that men are always dominant, they are strong, so men's syndromes are autosomal dominant diseases. And neurofibromatosis 1 and neurofibromatosis 2, this is also going to be autosomal dominant. and Peutz-Jeghers syndrome, where you also get polyps in this disease. We also have familial hypercholesterolemia and familial hypertriglyceridemia. So I can always imagine people always talk about their cholesterol levels being up, their triglycerides are up. So these two things, the cholesterol and the triglycerides, when they are familial up, familial hypertriglyceridemia or familial hypercholesterolemia, these are going to be autosomal dominant diseases. We also have Huntington disease, where a person is going to get their caudate nucleus degenerated and they will experience neurological deficits, depression. Sometimes they commit suicide because they get so depressed. It's basically a neurological degeneration disease. You also have myotonic dystrophy. This is also going to be a neurological disease. Basically, on the USMLE, how it comes up is that you shake someone's hand and then they cannot let go. This is the myotonic dystrophy. They also have cataracts and arrhythmias, problems with the heart, and frontal balding. Myotonic dystrophy is autosomal dominant disease. The last two diseases are going to be the Little syndrome, where you get hypertension, hypokalemia, and metabolic alkalosis. You just need to remember Little syndrome. So if you think of something that is Little syndrome is little, you might think it's recessive because it's small, like little, small, little, little, small. But here you need to think that whenever something is small, it could be dominant. So Little syndrome is going to be dominant. And pseudo hypoparathyroidism, you don't need to worry about this disease for now. You just need to remember if you have two pseudos and then hypoparathyroidism, so pseudo hypoparathyroidism, then it's an autosomal dominant disease. And these are going to be the autosomal dominant diseases for the USMLE.